Welcome to Season 3 of the To Health With That podcast, where we break up big topics into small bites. I'm your host, Dr. Amy Newsel, and I'm joined by my dear friend, women's health and fertility expert, naturopathic physician Kate Nomas, to break down infertility, hormones, and the whole baby-making shebang. This week, let's talk about the hidden tool in women's fertility arsenals that goes mostly overlooked. It's your annual exam. Kate, can you tell me what's involved in an annual?
Yes, absolutely. Ideally, you go to your annual every single year. And it doesn't mean that you're going to get a pap smear every year, because I think that's what women associate your annual with. So let's take that off the table as why you get your annual. You go to get your annual for many reasons, including sometimes a pap smear. So when you show up at your annual, which if you're in a small town, maybe with your primary care provider, can also be with your OB-GYN, can be with your naturopathic doctor in certain states, such as the one I'm in, Oregon. You're going to get a physical exam. They're going to do a breast exam. They're going to feel your thyroid, listen to your heart and lungs, hopefully. And then after they do that physical exam, they'll do a pelvic exam. And during the pelvic exam, that's usually when you're laying back on the chair and you're in the open legs, what we call lithotomy position, and you got your gown on. And then we're going to do what's called a bimanual exam, where 2 fingers are usually inserted into the vagina. And then we're also palpating on your tummy, feeling on your tummy. And we're feeling if we can feel any masses, like a large fibroid or masses around your ovaries. And then we're also going to do a pap smear if needed work. So you can get some screening blood work like cholesterol and maybe what we call a CBC or a complete blood count to see if you're anemic. Sometimes they'll test your thyroid. And of course, the doctor is going to see the person coming in front of them to decide which labs they necessarily need to run.
In this sense, even very basic blood work showing iron levels, showing, different types of anemia is really relevant, as well as those thyroid numbers.
Absolutely.
There are some parts of an annual exam that aren't necessarily relevant to fertility, but I do want to mention a few that are really overlooked. And so the breast exam, right? Nobody thinks of this as being a fertility thing at all. They're just screening for breast cancer, right? Great, and that's very important. But there are some things that your doctor might tell you that you can use to actually help on your fertility journey. Fibrocystic breasts or fibrocystic changes are important to fertility. So this is breast tissue that's become irregular or lumpy, may have soft, freely moving lumps that often become tender with different parts of your cycle. But fibrocystic breasts are a really great indicator that estrogen levels are either actually high or high relative to progesterone. And that matters very much for fertility, right? It may be interfering with ovulation or implantation. What about breast discharge?
Yes, that's an important one. And in non-breastfeeding women, this can be a sign of hormone abnormalities from the pituitary gland. And prolactin is one of those hormones that will be tested during an infertility diagnostic workup, but won't necessarily be tested by your OB-GYN during an annual unless you let them know that you are experiencing breast discharge. During a breast exam, we will try to see if there's any breast discharge. But it often doesn't show up during that exam. So it's important to always let your doctor know if you're having any nipple discharge, because that could be a sign of high prolactin, and that absolutely can prevent pregnancy.
So let's get to the pelvic or bimanual exam. Bimanual meaning with 2 hands. This is actually a really important part of the exam. For women who aren't ready for it, it can be a little alarming if it's your first annual exam. So moms out there, talk to your daughters about what happens in an annual. I remember my first annual, this is a weird story to tell, but I remember my first annual was with a very experienced OB-GYN. And we actually sat down in her office very professionally and talk about what she would do beforehand. And in retrospect, I appreciate that so much, because I've heard so many stories about women's first annual exams being really scary or invasive or feeling difficult for them because their doctor didn't take
Absolutely.
the time.
Right.
So doctors listening, take the time, right?
Yes,
Find out if it is your patient's first annual exam.
exactly. Informed consent is important. And I think we assume that we've got implied informed consent when someone is coming to an exam, but absolutely we need to know our patient and we need to know the person in front of us and we need to prepare them appropriately. And if it's your first or second, or you think you might have an STI and you're feeling tender and vulnerable, those are all times to talk with your clothes on first so you feel safe.
Yeah, absolutely.
Yeah.
Absolutely. And that's huge. So doctors are feeling for the size of the uterus. They're looking for uterine enlargement. After it can be normal after a pregnancy that uteruses do change shape a little bit, but not that much, actually, not as much
Mhm.
as you would think after, having a watermelon in there. And it's perfectly normal during a pregnancy, but at other times it could mean fibroids or other growth within the uterus.
Right. Polyps.
And
Mhm.
yeah, polyps, exactly. And that is typically a high estrogen or high relative estrogen situation, and it can very much interfere with a healthy pregnancy. And so that's definitely something to take note of. Although one complaint that I have with doctors is sometimes they do not mention it to the patient. So they will note it in chart notes, but not mention it to the patient. And so if I receive somebody's chart notes from their previous physician and see something like an enlarged uterus or suspected polyps or something like that that's never been followed up on, a lot of times I'll talk to the patient about it and they don't even know.
Right. And then we need to encourage that appropriate follow up.
Yes, absolutely. Appropriate
Mhm.
follow-up really matters in this case. Also, so enlarged uterus and an irregular uterus can be one and the same. Again, usually if a uterus is irregular in shape, it's being distorted by some growth that shouldn't be there.
Right.
The other thing, very important, is when ovaries are palpated, right? So this matters very much, but a lot of women will have lumpy ovaries. So lumpy ovaries, obviously, if you're getting your annual exam when you're ovulating, or around that time, near that time of your cycle, then your ovaries might be a little lumpier than average. And your doctor will ask you generally, or should ask you, what day of your cycle you are on when you get your annual.
Right. They'll almost always ask, when was the first day of your last menstrual period? And then they're calculating in their head where you currently are in your cycle.
Yeah, exactly. Exactly. But lumpy ovaries can also be abnormal. There are a number of different benign tumors. There are also cancerous tumors, but the most common cause by far is polycystic ovarian syndrome. And that is a huge factor in fertility.
And if a doctor feels this, then they're usually going to follow up with an ultrasound.
Yes, we would hope.
Yeah.
Usually, fingers crossed.
Right. With good
Um,
insurance, good healthcare, but ask for it. If your doctor mentions it and they didn't have any follow up, ask why. Was there a reason you didn't recommend a follow up ultrasound? And they might have a very good reason, or they'll be thankful you reminded them because it's hard work and they see too many patients with the pressures insurance put on them. So it's always a good idea to advocate for yourself with your doctor and ask
Absolutely.
follow up questions.
Absolutely. Yeah, that really matters. That really matters. Your doctor will also be looking for abnormal tenderness in some particular part. So a lot of times women will get a bimanual exam or a pelvic exam because they're having symptoms. And so in this instance, it's not that your doctor is trying to elicit pain. They're trying to figure out what part is painful because we can't always verbalize that.
Right. And if doctors see any signs of infection or yeast, then
Mhm,
they're going to do a vaginal swab, normally during the speculum pap portion.
mhm.
If they're not doing that, then they'll do that during the bimanual, and then they'll be testing for certain bacteria and viruses.
Exactly.
Yeah,
Exactly.
and
Yeah.
fungus,
And yeah,
all
all
the
sorts.
little bugs.
Well, and this really matters too, because vaginal infections, vaginal colonizations that aren't supposed to be there, or sexually transmitted infections can actually very strongly interfere with fertility.
Yep.
So this is something that we want to assess.
Mhm.
And so remember as well, 80% of sexually transmitted infections in women are without symptoms or without overt
Yes.
symptoms.
And
That's
I
huge.
worked at Planned Parenthood I volunteered at Planned Parenthood for most of my time during medical school, and I was a sex health educator. And then I actually worked at Planned Parenthood after I graduated from medical school doing, pelvic exams and STI testing. And it is so true. So it's just important if you have a new sexual partner, if you thought you were in a monogamous relationship and found out that you weren't, if you want to start trying to conceive, all of those are reasons to go in and get tested.
Yes, absolutely. And, in a lot of places there are STI clinics specifically, like if money is a factor, there are very often STI resources within a community that can help you to get those tests affordably.
Absolutely.
And then the last and sort of smallest piece of all of this is the actual pap smear, right?
Yeah.
And this is the part where essentially the tiny little swab is inserted and your cervix is swabbed. It can cause a little bit of cramping, sometimes a little bit uncomfortable, but it's very important to test for any cellular changes on the cervix or for HPV virus.
Yep.
And that's it. That's all I've got to say about an annual exam. Well,
Yay.
thank you, my dear. We'll
I
talk
know
again.
this is so fun.
Kate and I busted time today because, let's face it, we like to talk. Please watch the video version in the show notes. See more of Dr. Kate at naumesnd.com. That's NAUMESND.com. Or visit tohealthwiththat.com for myself, Dr. Amy. See you next week.